Hey everyone! Today, we're diving into an important topic that affects many women but isn't talked about enough. Pelvic Inflammatory Disease, or PID. You might have heard this term before, but what does it really mean? And what about salpingitis? Is it the same thing or something different? If you're someone who cares about women's health, or you just love learning how the body works, stick around because this video will break it all down in simple, easy to understand terms. Let's get started. Alright, let's start with the basics. Pelvic Inflammatory Disease, or PID, is an infection that affects the female reproductive organs. That means it can impact the uterus, fallopian tubes, and ovaries, all the important parts involved in fertility and menstrual health. Now you might be wondering, what about salpingitis? Well, salpingitis is a specific type of PID that mainly affects the fallopian tubes. Think of it this way. PID is the umbrella term for infections in the reproductive organs, and salpingitis is a specific type of infection within that category. Here's how it works. Most cases of PID start with bacteria entering the reproductive system through the cervix, the opening to the uterus. The bacteria can spread upward, causing inflammation, irritation, and sometimes even scarring in the fallopian tubes and other organs. One of the most common causes of PID is sexually transmitted infections, STIs, especially chlamydia and gonorrhea. But that's not the only way it can happen. Sometimes normal bacteria from the vagina can travel the wrong way, leading to an infection, especially after childbirth, miscarriage, or even certain medical procedures like an IUD insertion. Now, some women are more at risk for PID than others. Let's take a look at a few common factors. Unprotected sex. If an infection enters the body, it can travel up to the reproductive sink. Multiple partners. More exposure means a higher chance of coming into contact with bacteria. A history of PID. If you've had it before, the risk of getting it again is higher. Recent pelvic procedures. Things like childbirth, miscarriage, or even some medical procedures can allow bacteria to enter the reproductive system. The tricky thing about pelvic inflammatory disease is that sometimes women don't even realize they have it, but when symptoms do appear, they can include pelvic or lower abdominal pain. This can range from mild to severe. Unusual vaginal discharge, often with a strong smell. Pain during sex, especially deep pelvic pain. Painful urination. That burning sensation isn't always a UTI. Fever or chills, the body's way of fighting infection. Irregular periods, spotting or heavier than usual periods. Now, here's why PID and salpingitis aren't something to ignore. If left untreated, they can cause scarring in the fallopian tubes, leading to serious complications like infertility. Damage to the fallopian tubes can make it harder to get pregnant. Ectopic pregnancy. This is when a fertilized egg gets stuck in the tube instead of reaching the uterus. Chronic pelvic pain. Even after the infection is gone, the damage can cause ongoing discomfort. That's why knowing the signs and risk factors is so important. So, to sum it up, pelvic inflammatory disease is an infection of the female reproductive organs, and salpingitis is a type of PID that specifically affects the fallopian tubes. It's often caused by bacteria, can have serious consequences, and sometimes doesn't show symptoms right away. If you found this video helpful, be sure to hit that like button, share it with others, and subscribe for more health topics. Let's keep the conversation going in the comments below. What other health topics would you like to learn about? Thanks for watching, and I'll see you next time.